testing rates do dip over the weekend traditionally, but it's really, really important for us, especially over the next few weeks, to see those testing levels go up, even if it is on the weekend. Please don't hesitate to go to one of more than 300 places across the state where you can get tested, and if you have the mildest of symptoms, it is so important at this critical phase of fighting the pandemic that we keep those testing rates as high as possible. Overnight, we did have 3 cases of community transmission. All were linked directly to the Berala cluster, and those cases are being managed at the moment. Since 8 p.m, as has been reported this morning, there was that case regarding the emergency department at Mount Druitt, and Dr Chant will provide further information about that. I understand that during the course of this press conference, the Mount Druitt Emergency Department will reopen, but obviously as a precaution, all that deep cleaning, all that activity was undertaken to make sure that the disease hasn't spread since that case was identified, and Dr Chant will be able to provide further detail on that. I also wanted to thank the community for meeting all the restrictions we're putting in place, for wearing masks where we need to, for making sure that we're responsible every time we leave the home. And I appreciate very much the critical phase of the pandemic we're in. New South Wales, under the circumstances, is doing relatively well, but we are in the phase of mopping up. We are in the phase of really trying to identify any community transmission that hasn't been previously detected, to make sure that any chains which exist in the community, which we hadn't picked up before, have been and are being picked up. The case regarding the patient at Mount Druitt Emergency Department is still under investigation, so there's no direct link yet. But obviously, as we know from history, our contact tracers do a great job of finding those crossover points of contact, but at this stage that's not the case, but Dr Chant will provide further detail on that. I'll now ask her to provide details of those cases, but reinforce the need for all of us to get tested, reinforce the need for all of us to maintain all those rules that we've stuck by for nearly a year now. In fact, whether it's social distancing, good hand hygiene, making sure we are protecting those most vulnerable, and in those indoor settings, making sure that we're wearing masks, or where obviously social distancing isn't possible. I now ask Dr Chant to give her report, and then we'll answer any questions. Thank you.
So New South Wales recorded 3 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 8 new cases acquired overseas, bringing the total to 4,829. Of the 3 new locally acquired cases, all 3 are linked to the Berala cluster, a woman and man in their 30s, and a child who are close contacts of a previously reported case. These 3 cases are linked to a man and woman in their 30s who were included in yesterday's numbers, and we're investigating a potential exposure at an event on the 29th of December. This event is not the same as the one mentioned yesterday, in which a positive case initially failed to recall. That event took place on the 27th of December, but clearly this contact tracing flows from those events. As the Premier had indicated, there was a person overnight diagnosed in Mount Druitt Emergency Department. He was a gentleman in his 40s. A household contact of his, also in their 40s, has also tested positive. What we are doing as a precaution, he did spend some time in the emergency department whilst awaiting the test. As a precaution, we are ensuring that all staff or patients that may have had inadvertent contact are assessed and appropriate public health measures put in place. The emergency department has been extensively and thoroughly cleaned and is now coming back online. So just want to thank the cooperation of the residents of that area and local GPs for that impact on the service. In terms of testing, there's 18,570 tests were reported to 8 p.m. last night, compared with that 23,763 in the previous day. It is essential at this time that we strive for consistently over 25,000 tests, and I would like to see more approaching 30,000 tests as we push to get no community transmission. Also, I would like to enlist the support of general practitioners across the state. We know that general practitioners are very important as often pillars of the community in reaching out through your community links, but also in the day-to-day practice. So please encourage all your patients to get tested. If they're ringing up and for advice, please ensure that they're advised to go and get tested with the most minimal of symptoms. As I said, it is critical at this time that we achieve over that, up towards that 30,000 tests per day. Particularly of interest is those areas in southwestern Sydney and Western Sydney. And please, again, be vigilant for those new venues that are coming up online. I'm just going to mention a couple of them that we want to call out, and this relates to a public health alert that was issued yesterday. A number of new venues in Sydney's southwest and inner west were visited by confirmed cases of COVID-19, and this is publicised on our health alert last night. Anyone who attended the following venues at the times listed below is a casual contact who must be tested immediately and self-isolate until a negative result is received. And if any symptoms appear subsequently, get tested again. The Tai Hung Supermarket on 307 to 309 Illawarra Road, Marrickville, on Thursday the 31st of December between 3:45pm and 4:45pm. The Bankstown Central Shopping Centre, in particular the following stores: Target, Myer, Smiggle, Big W, Best and Lest, Oporto in the food court on Wednesday the 6th of January between 11:30 and 2pm. And Bankstown Central Shopping Centre, in particular the following stores: Big W, Smiggle, Oporto in the food court on Friday the 8th of January between 1 and 2:30pm. And Bankstown Service New South Wales at 350 to 351 North Terrace, Bankstown on Friday the 8th of January between 11:45 and 1pm. There are also a number of other venues on the New South Wales website, government website, so I do urge members of the community to regularly check that for updated information.
Any questions?
Dr. Chancellor, Mount Druitt individuals, do they present to the emergency department as a result of what turned out to be COVID-19?
Yes, they were diagnosed with COVID-19.
Is that why they went to the emergency department for treatment with that infection that turned out to be COVID-19?
They weren't known to have COVID-19 when they presented to the emergency department. Obviously, they had symptoms consistent with COVID-19 and were tested.
And that's why they presented to the emergency department?
That is why they presented to the emergency department.
How concerned are you about the exposure in that emergency department?
Sorry, I'll just go here and then over there. Would you like to ask your question?
What's the condition now? They're still in hospital?
They have been transferred to Westmead Hospital just because Westmead has the appropriate isolation facilities and greater access to tests. But I believe their condition is stable, but I would need to confirm that.
So how concerned are you about the level of exposure in that emergency department and the risk around that?
That risk assessment is currently being evaluated. As you know, we take a very precautionary role given the importance of healthcare workers being COVID-free, and also the fact that emergency departments have a lot of vulnerable people attend with underlying health conditions. So you would expect us to take a very cautious approach. Obviously, it is concerning when any patients or staff are exposed to COVID, but we're working through those assessments. But a number of patients and staff, as a precaution, have been captured. We will work through a risk assessment to understand what their movements were and whether there could have been any inadvertent exposure that would lead them to need to isolate and get tested. But
Dr. Chan, can you tell us whether this patient, this man, was wearing a mask when he presented initially to the ED?
The general approach would be that patients are asked to wear masks. Some patients with respiratory symptoms or when they're very unwell are able to tolerate a mask, and so it is a clinical decision. I will have to follow up whether he was fully wearing a mask at all times. They're the matters that we take into account when we do our risk assessment of the risk posed.
The case is still under investigation. How confident are you that you might be able to find any links to an existing cluster, or do you believe this might be a case that is not linked to significant cluster?
Look, I just want to acknowledge the work that's gone on into the wee hours of the morning, and that it's restarted again this morning to find out the source. I want to acknowledge the cooperation of the gentleman's family and seek the cooperation of their extended family. We are doing all we can to do rapid genome testing to understand where this virus sits in terms of its lineage and whether that gives us some clues of transmission. We're now focused on determining the exact time of this gentleman's illness. It may be that he's been unwell for a while, and so we, as you know, we try and pinpoint the onset time, and then we go back that 14 days looking for where that person has crossed over. So basically we will piece together his history, and we will piece together the genomic sequencing, and that will be supplemented by other testing which might pinpoint again and corroborate his history of illness.
Premier, can I just ask you?
That's correct. So the reason we're announcing it is obviously it's significant, and there will be the appropriate, but they will be included in tomorrow's numbers. We don't update you on every case we have in overnight, and it's pleasing to see the tests continue to roll in and the public health action happens. We issue alerts, but we will update the numbers accordingly.
On the family or the man, woman in the 30s and the child that gets positive as close contact of yesterday. Are you confident that all close contacts of the 3 cases today and the 2 cases yesterday have been identified and are in isolation, considering that you only found out these cases were linked to the previous case about a week and a half after that?
The public health units would have been onto this rapidly and reaching out. As I said, if people remember new information, always reach out to public health, and we'll be in contact with families to go through that. We obviously want accurate information, and it's probably important that now's a time to actually just, jot down information about what you're doing. If you're having parties or groups over, you're not, obviously the orders restrict that significantly, which makes it easier, but it is important for when public health ring just to go through your diary or other notes to who was present and what your activities were at this time. It is critical, but again, we just need to also put it in perspective that people do their best in giving us the history. We use multiple sources to correlate it, and we are confident that we want to express the cooperation of the family, and we are confident that we've worked through this chain of transmission. Our focus now is moving to this gentleman that presented to Mount Druitt overnight.
Premier, if I could just ask you a question about hotel quarantine.
Certainly.
The Varela cluster was a direct result of the leak out of hotel quarantine, yet we're seeing photos of private security guards not even wearing any personal protective equipment, not even wearing a mask, while in these quarantine hotels. How can this happen?
Look, can I just say on that particular issue, Health has ruled out that security guards were involved in the transmission of that case. I might ask Dr. Chant just to provide an update on that, if that's okay. But we rely on the experts to give us advice, and I understand Health has updated, and I'll again ask Dr. Chant to provide to the community the fact that we have updated those protocols as per the Communicable Diseases Tribunal or Board. So we make sure that we update all of the protocols when appropriate, but I will ask Dr. Chant just to provide that extra information, firstly excluding the fact that security guards were involved in that initial transmission, and secondly those updated protocols as well.
So the original transmission in relation to the Baralla cluster occurred through, as you're aware, the transport of through patient transport services of a person from the airport who had symptoms. In terms of the Avalon cluster, the CCD footage around positive cases that were in quarantine have not indicated any contact between security guards with those cases. That's been part of the thorough avenue of investigation. The guidance that our quarantine hotels were operating under were the guidance of the Clinical Excellence Commission. The Clinical Excellence Commission has updated that guidance, and there will be mask wearing by all security guards.
Premier, if I could just ask you, is that security guard still working in Sydney's hotel quarantine program?
Well, it's important, I don't know the answer to that question, but it's important to note that those protocols have been upgraded overnight to make sure that there is absolutely no stone left unturned when it comes to the security and the requirements around our quarantine system. Can I stress that we do take our advice from the experts, And that's what's really important. But the other thing to acknowledge is we're never afraid to update our protocols if that's what's required. We're learning things as we go along. We have to be honest about that. We have to be flexible. And if there are opportunities for us to tighten what is already a very tight system, of course we will do that.
Do you think that, we're seeing these leaks out of hotel quarantine, 4 so far. Do you think that, you've said many times that we have to just accept that there will be a leak every now and again out of hotel quarantine, and that's just a fact of life. For, say, a tourism operator that's facing severe financial distress because of lockdowns and restrictions, is that still good enough?
Well, the other question is, what do you say to thousands of Australians trying to get back home? It is a very difficult balance to have, and I'm relieved that we're halving the number of returning Aussies for the next month to give us a pause, to give us time to understand the new strains of the virus that are mutating around the world, that exist in many different countries now. So it's important for us to take a pause in that regard, but we have to be very honest. There is no way of eliminating this virus so long as it exists around the world, unless you stop all overseas travel. And ironically, it would impact the hospitality industry if flights stopped and we didn't have certain airlines even coming to Australia anymore. And that's the balance you have to find. In supporting the hospitality sector, we have to think about what happens post-COVID. We need to think about what happens during the vaccination process. I'm assuming that when certain proportions of populations are vaccinated, there will be opportunity for international travel. We have to make all these considerations, and it is a fine balancing act. I won't deny that. But we have to consider all those things, including the impact of the hospitality sector were there no international flights coming in whatsoever, especially as we know the vaccine's starting to be rolled out around the world, and we'll receive it here in Australia in short time as well.
Would you ever support an independent inquiry into Sydney's hotel quarantine program, like what happened in Victoria last year?
Well, I don't mind that, but our focus as a government has to remain on keeping the community safe. But can I make this point, and I want to make it very strongly, the federal government did an audit of all the quarantine systems around Australia, and New South Wales came out on top. But no system is perfect because the pandemic, the disease is insidious, it's contagious. And you can't assume that 100% of people will do 100% of the right thing every single day in, day out. People want to do the right thing, but sometimes there is human error. We have to accept that, which is why we have the settings in place, why we have the restrictions in place, and why we have to assume New South Wales has been to date overwhelmingly been carrying the burden for the nation, returning 3,000 Australians to our shores every week. It is a huge task. And no doubt, perfection is not possible during a pandemic. As much as we'd like to think there is perfection, there is not. And we have to assume that there will be incidences where there are concern. But let's put things into perspective. All I say to people is not necessarily the words we use, but look at the actions and the outcomes. Look how we've been able to manage those outbreaks when they've occurred. Yes, it has been painful. Yes, it has been difficult, but look at the way New South Wales has been able to respond, and I credit our health experts, our police and the community more than anybody for coming forward and getting tested and responding to the rules we've put in place. But this is how we manage to live with the pandemic. We have to accept this is the reality, and unless you stop flights coming to Australia, which could be permanent if we're not careful, unless you stop Australians being able to come back home, we do have that risk, and we have to accept that.
Today, all flight crew, including foreign-based flight crew, are being tested on arrival into New South Wales. What happens to flight crew a foreign-based flight crew who test positive for COVID-19?
Yeah, I might ask Dr. Chant.
So clearly it depends on the time frame for the test results that they have. The flight crew are permitted to depart if they're on a tight turnaround and we haven't got the test result back. Obviously, the companies themselves are doing their own testing, so this is sort of a subsequent line of defence. Certainly, we work through the normal processes in investigating whether the case is an old one. So, as you can imagine, people are coming from countries where COVID infection has been much more common, and so many will have old infections. And so we will be assessing cases rapidly on a case-by-case basis, if the person is still here, to determine fundamentally whether it's an old infection versus a new infection. As I've indicated to you, people can shed the virus periodically for many, many months after infection, and our tests are very sensitive. And so the algorithm will be a complex one, but will have to be an assessment case by case on the basis of the information we have at hand about whether they're infectious. But if they're infectious, then we will not be allowing them to be flying back at that point if they still are in New South Wales at the time when that diagnosis is made.
Has there been any more instances that have come up in the testing of the genome sequencing of the UK and South African strains?
Look, I would have to check that, but I'd just like to say that it's expected that we will continue to see these variant strains and that they will be an increasing proportion of it. As you've seen in the UK and other countries, the UK variant strain is becoming more common. And so we will be announcing periodically and giving you updates on the overall proportion of overseas travellers, but I would expect that to be increasing.
Minister, if I could ask you, so there's some video of...
Who pays for infectious flight crew to stay in New South Wales if they're prevented from leaving? Is it New South Wales or the airline?
My understanding is the airlines are funding the quarantine for their flight crew, but I would have to seek clarity around that.
Minister, if I could ask you, there's a video of some violent incidents at premises involving the Q code checking at one yesterday at a McDonald's. Cash register was smashed, staff were abused. And you're here today, you have been, appealing for people to do the right thing at these premises, but yet staff are copying this kind of behaviour.
QR codes are to keep us all safe. Anybody who thinks it's okay to not do a QR code, but more importantly, to attack staff members who are trying to enforce it, really need to have the full weight of the law thrown at them, and I would hope they have. It is absolutely appalling what I saw in that TV footage.
And, I mean, how is it that people now haven't got the message about this? I mean, the message is driven every day, isn't it? And the full force of the law, what could that potentially be?
We've had almost a year of COVID, and we all know the value of QR codes to keeping us safe. Somebody who has crawled out from somewhere and decided to actually start abusing staff needs to have the full force of the law thrown at them. I'm confident the police will do that.
Before you went on leave, you promised businesses of the Northern Beaches that there would be financial support. Where are we up to with that?
Well, what we certainly committed to was engaging with local businesses to see where they were at, to see what support we could offer them. I know that many members of my team, including the Treasurer, have engaged with the Chambers of Commerce to ascertain where the businesses are at. Last week a decision was taken to make the Northern Beaches one of the first areas to be piloted using the voucher system, so we are encouraging the rest of Greater Sydney and in fact the rest of New South Wales to frequent those businesses. If there's more we need to do, we will, but those assessments are taking place as we speak.
Just on border closures, with JobKeeper ending in March, should states who close their borders be more responsible for footing the bill for affected businesses?
Oh, look, this is why I have been outspoken regarding border closures, because it's not just the health impacts we need to worry about, but what it means for people's livelihoods, their jobs, their mental health. And I think as a nation we need to do better in that regard. And I feel that we need to have greater protocols in place for dealing with those issues. So I'll come here and then I'll come back there, yeah.
Sorry, just on the cricket, some spectators were ejected for racism towards the Indian team. Would you support harsh penalties and a zero tolerance approach to such?
Look, if those claims are proven to be correct, it's so un-Australian. There is no place for racism at those events. It's an opportunity for us to showcase ourselves to the world, and the vast majority of Australians are good, decent people that are poor and make sure racism isn't part of our lives. And if those claims are correct, it is of concern, and I know that most Australians would be concerned by those comments.
Do you think we have, given that discussion, do you think we have an inherent problem with racism in Australia, and are you worried that the Indian cricketers may just say, well, we don't want to play there anymore?
Look, I don't believe we have an inherent problem with racism. I don't. I do believe that it rears its ugly head from time to time, and we need to always be vigilant. because it only takes a handful of people to really start a process that can be very concerning. And that's why we have to be vigilant against any comments, against any actions, even though it's conducted by only a very small minority of people. Unless you put a stop to it, it can get hold. And I don't believe it reflects Australia. I don't think it reflects the vast majority of Australians. Quite the opposite. I think we have a proudly multicultural nation, one of the best in the world. But when it does rear its head, we need to clamp down on it immediately to make sure people understand that has no place in Australia.
In Sydney now and so forth. Just looking ahead to other events coming up, we do have the Sydney Derby on the weekend. Are we looking at what's happening there? That's the Olympic Stadium.
No, we are. And can I confirm that the government is looking very closely, based on health advice, how we manage these major events in a COVID-safe way. I do want to stress that our intention in New South Wales is to always continue with life as normal as possible, including hosting major events. But the question is, how can you make them COVID safe? And that always depends on what's happening at the time in the pandemic, what phase we're up to, what the level of risk is. So I can confirm that all major events will continue in New South Wales, but the question mark is, how do we manage them in a COVID safe way? And obviously we rely on the health advice. So we have some general principles in place, but we also need to look at those larger events on a case-by-case basis to make sure we're dealing with the event organisers, making sure that there's final decisions made right up until the event's being hosted to make sure that we're not leaving anything to chance and that everything we're doing is as COVID safe as possible.
What's your take on Australia Day, Premier? Those big events that we often have at a local level. We've had the discussion about New Year's. What about Australia Day?
I think we've demonstrated as a state and as a nation that those important milestones can, should and will be recognised, but it's doing it in a COVID-safe way. For example, the events the New South Wales Government is hosting are all continuing, but they'll obviously be done in a COVID-safe way. And I would encourage everybody to recognise Australia Day for the significance that it has. And I think this year it has greater significance because we've all been through a very difficult year. I think we're feeling closer to each other than ever before and also feeling proud of the nation we live in. When you look at other places around the world and the angst and real difficult times that other nations are going through, I think we should be feeling prouder than ever of being Australian, and I think it's appropriate to mark that day in a COVID-safe way.
Premier, if I could just ask you again, you said, back to the hotel quarantine, you said that overnight protocols in hotel quarantine were upgraded. What exactly are those protocols?
Well, Dr. Chant's already outlined that, and that is to make sure that all security guards continue to wear masks all of the time. And Dr. Chant outlined that. That is in response to the advice we've received from the experts in managing the disease. And as I said, New South Wales has been through a number of audits in terms of our quarantine system. Every time we've been given the highest marks in the nation. But there's no such thing as perfection, no such thing as getting it right all of the time. And every time there's an opportunity for us to do better, we will. And as the pandemic evolves, as we review the settings, if there is an opportunity for us to make things stricter and tighter, of course we will do that.
So you can see private security guards are still a risk in Sydney's hotel quarantine program?
Well, what we've done in relation to the quarantine system from day one is put police in charge, backed by health advice, and that system has proven to be effective. And I think why New South Wales has dealt with the pandemic to date, and I say to date, because it's always a volatile situation, the way we have is because we've had a whole of government response. We need to allow the health officials as much as possible to focus all of their efforts on contact tracing and getting out important community information. And we have to let those who are expert in security matters, expert in dealing with those quarantine issues to also do their jobs.
Premier, the Victorian Health Minister said that he did in fact notify the New South Wales Government that Victoria was going to close the border. Yesterday you said it would be good if states talk to us in New South Wales before you close the border. They did, didn't they?
Well, look, can I say that the first border changes happened a few days before Christmas. Can I make this generic comment? Sometimes they let me know, sometimes they don't. When they do let me know, the decision's already been made. There's no doubt that our health officials talk on a daily basis. There's no doubt the health ministers are in regular contact. But we have to appreciate that when you're closing a border, it affects all of government. It affects every single citizen in New South Wales. It affects citizens in other states. And I think as leaders, and I include myself in this, all of us can do better. we should allow each other to have input into those processes rather than just being told of the decision. As the Premier of this state, I would love to have been able to have an input to say, rather than closing off all of New South Wales or all of Sydney from a particular state, please just consider the Northern Beaches, or give us 24 hours to get back to you on how we can manage this. All I'm suggesting is, as leaders, and again I include myself in this, all of us can and should do better when it comes to borders, because it affects thousands of people, sometimes hundreds of thousands of people, when multiple border changes are happening around the nation. And sure, they can let us know just before a press conference that something is happening, but if the decision's already been made and you haven't had any input, I mean, that's a different issue. And again, can I say, there's enormous collegiality when it comes to our health officials, to the health ministers, but I think that should be extended more broadly to political leadership when it comes to a major decision like that. And for example, you know, when you have a border arrangement with a permit system and you kind of don't have input into how that's managed, it can affect your own citizens. And all I say is I think all of us can and should be doing better.
On-the-spot fines for drug possession. If people are not paying their on-the-spot fines for drug possession, is it much of a deterrent to hand them out anyway, and what can the government do about it?
Yeah, I know Minister Tudor Hope is, as the Minister for Revenue or the Finance Minister, is having more to say about this. The advice I've had from him is that most people are paying those fines. It is acting as a deterrent, but he will be able to provide further information on that.
Sorry, can I just ask you one last question, just in relation to the Mount Druitt case? I imagine you don't want people turning up to emergency departments if they might have COVID. So what is the advice for somebody, with no criticism of that person in general, but just if you could just reinstate, do you want people going to clinics? Do you want them to call the hotline? Like, what should people, you know?
So obviously, if you have, for COVID, unlike most other conditions, we're actually asking people to come forward with very minimal symptoms that potentially they would not seek even health care generally. They would generally wait and the symptoms would resolve. But as part of your community efforts, we want you to come forward because we're trying to achieve no community transmission. So go to our website. There are a variety of different sources. We have New South Wales Health Run COVID clinics in a number of settings. We have a variety of different modes, some drive-through. We also have a number of partners in the private system that run, and many of those don't require a GP referral. Those that do require a GP referral, if they're the easiest for you to get to, you can ring your GP, and your GP can do those electronically or in other forms to meet those requirements. But obviously, if someone is sick, that is the place for our emergency departments. And if we have contacted you and you're a close contact, or we're asked you, go to the local emergency department and we will sort you out. Emergency departments are there for the more serious end of the spectrum, but if they are the closest place for you to go, then go. But on our website there is a large number of COVID testing sites, and we do encourage you to use them. But your general practitioner will help you navigate. So give your GP a call and they'll help you as well, but please also go onto our website.
Social event.
The three new cases that are linked to the Barella cluster, 2 adults and a child, are they one family, and are they family members of the other 2 that were announced yesterday, or is it?
They were all linked in a family, obviously close family friends and family networks, and clearly they stem from the event took place on the 27th where the person had failed to recall that, and then we've done who went to that event and then set up the chain. So that's the 3 cases are all linked. To my best knowledge, they are one family, but again, I'll confirm that.
That second social event that you're concerned about, the second social event, how much larger was it? Was there an initial social event and then a second one?
So they're different settings. So when we actually had the first case forgot to recall or didn't recall that they'd had a gathering at their home, a small gathering. But obviously, because I've indicated to you, household gatherings are one of the highest risk, and that's the whole process of why we've limited household size visitors to 5 at the moment, because we know that that's a more intense exposure over a couple of hours where you're very much unlikely to social distance and other COVID-safe practices for the whole period of that event. That then set up other cases, and then there were subsequent events. And so that's a chain of transmission, and we're currently sort of confident that we have got to the full end of it. But as you're aware, we do end up seeing transmissions within households, and everyone has to wait for the full 14 days. So the full effect of this could not have been prevented, but what could have been prevented was the other people unknowingly having COVID in the community. So the lesson from this is twofold. If I could just urge people to think about all their activities, file it away in their mind, diaries or notes, just so that can help us, but also get tested at the most minimal of symptoms and assume you have COVID if you have any of those COVID symptoms, and please get tested.
How sick was the man when he presented to Mount Druitt? How sick was he?
We're not releasing information about our usual process is that we check with the family to see what information about condition is able to be released, and we will do that in due course.